Hey Amazon Prime members, why pay more for groceries when you can save big on thousands of items at Amazon Fresh? Shop Prime exclusive deals and save up to 50% on weekly grocery favorites. Plus, save 10% on Amazon brands, like our new brand Amazon Savor, 365 by Whole Foods Market, Aplenty, and more. Come back for new deals rotating every week. Don't miss out on savings. Shop Prime exclusive deals at Amazon Fresh. Select varieties.
This is Scott Becker with the Becker Private Equity and Business Podcast. Today's discussion is better together versus a zero-sum game, a look at healthcare. So here's the situation that we're in healthcare, and we talk about this often. And this was prompted by listening to a speech today by one of the most brilliant speakers I've ever heard talk, Pastor Chris Harris. Chris Harris uses the term better together to talk about healthcare and life issues and so many different issues about Black and brown communities and broader communities. We haven't talked about supply and demand in healthcare. We've got 350 million people and only about 1,060,000 doctors in our country. And that's a metaphor for every other specialty that we're losing and every other allied health practitioner that we're short on. The reality of all this stuff is it's about communities getting both their fair share of what's out there. But on top of that, and more importantly, if we don't fix the supply and demand problem in healthcare, everybody's going to suffer. All communities will suffer. So the advocacy has to move towards how to increase the supply of doctors, nurses, allied health practitioners, and everything else. We could not agree more with Chris Harris, one of the most brilliant speakers I've ever heard, one of those brilliant people I've heard speak, Pastor Chris Harris, about that we are all better together, and we have to increase the supply of doctors, nurses, allied practitioners, and everything else. We're at a spot where wait times for ERs have moved up to 3 hours and 45 minutes. That's incredible. That's for an emergency care visit. We're at a spot where there are huge shortages of doctors. There's only 1,060,000 doctors, 340 million people. This idea of preventive care as a solution, good luck with that. China and India have tried that. COVID, if anything, showed that if you don't have enough doctors and nurses, your hospital's health system either gets overrun or you have to lock everybody down. So preventive care, good, but we better trust and verify by creating more doctors, more nurses, more practitioners, and so forth. And to echo what Chris Harris says, at the end of the day, we need to view this as better together and not a zero-sum game. My hat is off to Pastor Chris Harris. I could not have agreed more with his comments today. I loved listening to speak. I was inspired. Thank you for listening to this episode of the Becker Private Equity and Business Podcast. P.S. We each spoke at the Humboldt Park Health annual meeting, brilliantly run by the leader, Jose Sanchez, one of the best in the business and one of the best people in the business. Thank you for listening to the Becker Private Equity and Business Podcast.
PenFed Free Checking offers zero fees and zero balance requirements for zero hassle. PenFed Access America Checking lets you earn money on your balance for dreams big and small. Choose the best account for you and start making the most of your money. Learn more at penfed.org. Federally insured by NCUA. To receive any advertised product, you must become a member of PenFed Credit Union.